Copper is absolutely essential for health, but too much of it can be deadly. Discover today how liver copper toxicosis could be impacting your pets and what you can do about it. I'm Dr. M. Welcome to VMC. Join me. You'll learn something today. Now, off the start, we need to recognize that there are a myriad of different reasons why pets can experience liver problems, and a lot of things that impact our pets' livers cause an acute hepatitis, meaning that they cause a short-term inflammation of the liver cells and liver function problems. But there is a subsection of liver disease that is classified as chronic hepatitis, and we are going to be focusing down that pathway today. Down the chronic hepatitis subheading, there are a number of potential causes. For a lot of them, we do end up classifying our pets as having idiopathic hepatitis. That simply means we don't know the exact cause of their chronic hepatitis, so we just term it under the catchphrase idiopathic for now. We need more research. There's evidence that there are some medications that can impact the liver and cause chronic hepatitis, and in people, there's a good amount of research showing that around 20% of chronic hepatitis is actually caused by people taking supplements and non-regulated things over the counter that is causing chronic hepatitis. We don't have that same research in pets, but we desperately need it because unfortunately there are so many people out there who just are giving things to their pets thinking, well, it couldn't hurt, might help, and this could be causing harm to their pet's ability for their liver to function. However, the topic of today's video doesn't cover any of the above things that I just briefly mentioned. We will be narrowing our focus down to copper-associated chronic hepatitis. In order to understand this, we do need to address the role of copper inside of our pets' bodies. Among other things, copper helps your body to make red blood cells, helps to keep nerve cells and your immune system functioning well. It also helps with forming collagen, which is a key connective tissue. Lastly, copper helps the body to absorb iron and to make energy. It is a very crucial micronutrient that our pets need. We also need to understand that the major organ for copper metabolism is through the liver. So the liver is responsible for copper storage and copper redistribution through the body. It will also help to rid the body of excess copper. So now that we know what copper does, let's cover what's happening when this copper storage and excess copper elimination is going awry. So as you may have already guessed, there are two ways that a pet may have excess copper within their body. The first might be if they are simply ingesting far too much of it, and the second would be if they have an abnormality within their body that reduces their body's ability for eliminating the copper that they ingest that they don't need. When copper exceeds hepatocyte transport and binding capabilities, meaning when there's too much copper for the liver cells to be able to cope with it, this will cause hepatocellular damage, and this will lead to acute and then over time chronic hepatitis. So the liver cells are being damaged by the presence of too much copper that it's unable to get rid of. We know that a lot of copper toxicity is in specific breeds of dogs, and there are some genetic components here. Some of the more at-risk breeds include Bedlington Terriers, Labradors, Dalmatians, Doberman Pinschers, Westies, and a few others. In the Bedlington Terrier, we know that the issue is with an abnormality in how copper is transported. In the Labrador Retriever and the Pinscher, there seems to be abnormality in the protective mechanisms against excess copper being kept within the body. And for both of these, we do now have some genetic testing. And in the Bedlington Terrier in particular, there has been quite a good amount of headway in removing copper toxicity from that breed, which is wonderful. It's a little bit less known how the genetic tests for the Labradors and the Doberman Pinschers relate to whether or not that dog will develop copper toxicity in the future, but reputable breeders are screening for it. There is one other factor that I haven't covered yet. In the early 1990s, there were some changes made to the types of copper ingredients that are being used in pet food. And these changes resulted in a higher amount of bioavailability of copper within pet food. In conjunction with that change, we also have a minimum copper requirement for pet food, but in some places like North America, there is no maximum. And there are a number of specialists who are calling for the need for a maximum copper limit to be put onto pet food manufacturers, as an increase in copper toxicity has been noted since that change was made into how bioavailable copper is in pet foods. We also have this contributing factor that there is an increasing number of people who are feeding alternative type pet foods. They are not going to be aware of how carefully copper needs to be titrated within pet foods, and so diets that include a good amount of vegetables, where people are thinking they're doing the right thing because they're feeding fresh homemade diets, actually could contain way too much copper, and it could be one of the issues that puts their pet at risk. And this lack of knowledge about how bioavailable micronutrients are is one of the reasons why veterinarians and veterinary nutritionists recommend that we feed our pets diets that are research-based, properly formulated, and that meet the WSAVA guidelines. If you aren't familiar with what those guidelines are, I will link the video where I cover it and who pet nutrition experts are down in the description. The symptoms we might see when a dog is experiencing chronic hepatitis can be a little bit unspecific, which can be a bit of a pain. In about 60% of patients, we will see a decreased appetite. A lot of them will also have lethargy or tiredness. We might also see that they pee more and drink more to try to compensate for that increase in urination. They might develop icterus, where their mucous membranes or the insides of their ears or the whites of their eyes turn yellow. And we can also see ascites, where they are getting fluid accumulation in their abdomen and they look a little pot-bellied. In about a quarter of patients, we will see vomiting and diarrhea, but it doesn't always happen. And then there are also less common symptoms where they might start to have bleeding abnormalities, or they might start to have neurological abnormalities because their brain function is impacted. This can include things like seizure activity. Now, chronic hepatitis often has a long subclinical phase, meaning the liver function is struggling, but from the outside you could never tell that the pet has any abnormalities. For this reason, it is so very important to be seeing your veterinarian regularly, and this is one of the reasons why all of my pets, and I recommend all of my patients, have a full blood work panel done at least once a year, just so that we can check the trend on how all of their organ function is. Because say over time, if we're noticing this trend where liver values are creeping up and up and up and up, then that should trigger us to do a little bit more investigation into what's going on, and hopefully allow us to catch the fact that your pet is struggling with liver function before they become clinically symptomatic. The earlier we catch these things, the better. Let's now address how we diagnose chronic hepatitis in your pets. Well, the first step your veterinarian will do is a physical exam and get a good medical history from you as well. This should include things like if you are giving any supplements, what type of diet you're feeding, symptoms you're noticing, how long they've been going on for, when last blood work results were done, and so on. After that, I would expect that there will be a blood work panel done. We might also do additional, more specific blood work that tests for different parts of liver function, like how bile acids are doing. However, depending on what stage of hepatitis your particular pet is at, the blood work results may or may not give us some answers. And so what's often necessary for these patients as the next step is an abdominal ultrasound. This pairing of a comprehensive blood work panel and abdominal ultrasound will allow us to rule out a lot of other diseases that can cause very similar symptoms, because as I mentioned, these symptoms really aren't that specific. It is important to remember that there's a lot of differences between different ultrasonographers, because there's a lot of variation between how much people will pick up on an ultrasound, and that depends on how good of a machine they're using, what their individual skill level is, and the like. And so in order to get the most information possible, it's important that you see someone who does a lot of animal ultrasonography and who's good at it. Now, during an abdominal ultrasound, sometimes we will take little needles where we will take some cells from organs that we have concerns about. Unfortunately, we cannot definitively diagnose chronic hepatitis with a fine needle aspirate. You actually do need a bigger biopsy size, and so doing a laparoscopic biopsy may be recommended. That will depend a little bit on what stage of disease your pet is on and what differentials we are still considering based on the rest of your pet's test results. When the biopsy is taken, we can then test that tissue for the concentration of copper that's in it, along with some other tests in order to further narrow down our differential list of possibilities in order to give your pet the diagnosis of a copper toxicity causing chronic hepatitis. Now, it's possible that even with a biopsy, we may not always get a diagnostic sample. This can be a little bit of a tricky issue to definitively diagnose, but the steps that I outlined before gives us the best chance, and usually at this point you are working with an internal medicine specialist, and so they can further guide you on if we should be considering redoing biopsies if you didn't get a definitive answer, or if we have enough information that we can just make a presumptive diagnosis at this point. So the treatment for copper toxicosis causing hepatic damage is twofold. First, we need lifelong restriction of copper. This is a bit tricky because that means using a prescription liver diet. Pills, Royal Canin, and Purina veterinary diets all have options with low enough amounts of copper in them. We also have to consider the amount of copper that is in the water that your pet drinks. And so this is one of those rare situations where we may end up needing to use water that does not come out of your house's tap for your pet. The second prong of our treatment plan is to do removal of as much of the excess copper as we can and to support the liver function going forward. So in order to remove copper, we do a process called chelation. Now, a medication called D-pen is the chelation medication of choice. The amount of time that your pet requires taking that medication will depend on how high their liver copper levels are and how well they respond to the chelation treatment. Generally, we end up using chelation for anywhere between 6 and 9 months. Now, this drug will bind the copper and help the body to remove it, which is excellent because the liver isn't functioning well enough to be doing that job. So we use the chelation medication to help the liver out. We end up needing to monitor blood test results and sometimes even do a repeat liver biopsy in order to confirm that we've been doing chelation for long enough before we end up stopping it, as we don't want to leave the dog with excess copper in their body. Sometimes veterinarians will also recommend using a supplement called SAM-E as well as some vitamin E in order to try to help support liver function. But to be very straightforward and blunt with you, there isn't a great amount of research demonstrating the efficacy of using these two things, so you may be advised not to use them, or your veterinarian may have you give them a try and see if it helps to support the liver function and reduce some of the liver values. Prognosis is a little bit tricky. The earlier it's caught, the better. The less damage to the liver, the better. Once we get pretty severe liver disease and we start seeing things like cirrhosis, the prognosis is not very good. We may get a few months from pets after that point. And if they have that severe of a chronic hepatitis, a lot of these pets will end up dying from their liver disease. If we have caught the issue early and your pet does not have any cirrhosis or advanced liver disease symptoms, then the prognosis will be better. I want to thank you so very much for watching VMC and taking the health of your pets seriously. I love the community that's being built here that cares deeply and wants to do the best possible for their pets. This particular topic was requested a few different times, and I apologize to those who have been requesting it. It takes me a while to get to topics, but finally have this one out. If you found this video helpful, please like and subscribe, and don't hesitate to share it with anybody else you know who might find this information helpful, especially if they have one of those breeds that I mentioned near the beginning of the video. I do put out a new video most Fridays, and YouTube thinks that you will like this video, so give it a try. All right, bye.